Appreciate everybody coming this morning. Thank you for the understanding the change of venue. Today we want to talk about a huge issue in policing nationwide as well as the CMPD, and we are no exception to this. This is the mental health crisis. Last year, our crisis intervention trained officers responded to more than 800 calls for service. Last week, City Council gave CMPD approval to move forward with its plan for a community policing crisis response team, or short for CPCRT. This team will help us better serve community members experiencing a mental health crisis. Now, we are finalizing plans and expect to launch this program in April of this year. We're here today to tell you more about the program. We have two speakers. First one is our Chief of Police, Chief Kirkputney, and our second one is Keisha Ginn, who's president of Crisis, which is the company that will provide the mental health clinicians who will work with our officers. We have several individuals here who are available for one-offs at the end. We have Major Nelson Bowling, who is overseeing the program. We also have Fonda Bryant, who is a mental health advocate, as well as Keisha Ginn as well. At this time, I'll turn it over to Chief Kirkputney. Chief?
I'm not that advanced. I think I'll use paper notes. Good morning. This is a big day for us. You've heard me talk about, some of you were there when I presented this idea to council last fall, trying to really move forward and help us de-escalate sensitive encounters that we have with people who are behaviorally or mentally struggling in crises. So this is the results of that work. Just so you know, this is the type of call that really keeps you up at night, because these are people who really need our help most and will respond. Sometimes there are tragic consequences. I'll talk about, and you've heard me talk about, the legal standard, and we meet that quite often. What we're trying to do right now is show you how we're attempting to meet that moral standard, that higher standard that our officers always try to achieve. We're excited about the program. We believe this is an opportunity to better de-escalate high-risk situations. Our goal is always to reduce injuries, obviously to the community, but also to our officers. I tell you, they put themselves in harm's way. This is an opportunity that we can try to lessen those encounters. By coming as a team for the crisis intervention trained officers, CIT officers, and our clinicians, it's an opportunity to have professionals in the car with us. There'll be 6 teams. They'll respond, obviously, to people in crisis, but they'll also do what I'm most proud of, is proactive work. You know, people need assistance. You know, federal funding for mental health has decreased significantly over the last decades. So what we're trying to do is fill in gaps. We want to be proactive in taking service providers to people that we have either experienced or they've come up on our radar in some other means with some of our partners like Crisis, you'll hear from here shortly, so that we proactively can have people take their meds and do things that can keep us from having those escalated encounters that we want to avoid. The unit will be working 24 hours a day, 7 days a week, which is why we have 6 teams. Again, as I said, as a CIT officer and a clinician in the same car. They will be called whenever they encounter people in crisis. The big thing I want to make sure you understand is we've accomplished our goal when we're not incarcerating people who are in crises based on behavioral or mental issues. What we're trying to do is be proactive so we can give them those services so that the last resort is not locking up people that we should be trying to render aid to. The beauty of this is it also gives us the opportunity when we respond to someone in crisis to have experts who can follow up virtually immediately. So what we're trying to do is be proactive so we reduce the number of encounters that are negative, but also de-escalate them better once they do occur. Obviously, we can do it without our partners. Crisis is our main partner here. You'll hear from Keisha Ginn. No relation to Mr. Ted Ginn Jr. I am a Panthers fan, but someone that we couldn't do this work without. After she speaks, we'll open it up to the 2 or 3 questions that I'm sure you're going to have, as you always never disappoint. Ms. Ginn.
Good morning. As the chief mentioned, this is a very exciting day for our community. We are very excited that Crisis is a part of this process. We have, since our inception in 2006, worked in close partnership with CMPD and have worked to strengthen that partnership over the last few years. My current community mobile crisis team carries CMPD radios, and we respond daily to requests from officers to assist in managing individuals in our community who are struggling with behavioral health and or substance use disorders. So we are delighted to partner with CMPD to provide them with this specialized team to be able to assist them in addressing the mental health needs of those in our community. As the chief mentioned, the role of these six clinicians, we will pair 6 fully licensed clinical social workers and professional counselors with a crisis intervention trained officer. They will work hand in hand, partnership 7 days a week from 7 a.m. until 10 p.m. With overnight support as needed to address the needs in our community. These clinicians will be extensively trained in de-escalation and crisis intervention skills. They will, once on scene, provide a crisis assessment. They will work with the individual and the family to arrive at a safe and appropriate crisis plan. And as the chief mentioned, we are very excited about the follow-up component, which will allow these clinicians to, again, work with the individuals and families to help assist with linkage and, a connection to appropriate community resources. This will be huge for our community. Many of us have engaged in conversation over the years in terms of the apparent gap, the bridge in regards to law enforcement and the mental health community. So I think that this is a huge step in the right direction in terms of working to bridge that gap. An encounter with police can be scary for any of us. And so that fear is intensified when we have an individual who is struggling with a mental health or substance use disorder. We believe that the mere presence of a clinician on scene who's able to establish rapport and build trust relatively quickly with these individuals will provide a sense of comfort and support as we work to get them connected to the necessary community resources. I don't think that any of us can fully wrap our minds around all of the positive outcomes that we will arrive at as a result of this very important initiative. But I do believe that the number of individuals, all individuals involved as it relates to safety will go up. I believe that the number of individuals hospitalized and or incarcerated will go down. Our hope is that we will be encouraged by the number of individuals who we are actually able to get linked and connected to community resources, appropriate community resources, which I think in turn will result in fewer calls to 911 for behavioral health issues. So again, we're very excited about this partnership. We're very excited again to be a part of this process in the Mecklenburg community. And again, at this time, the chief and I welcome any questions that you all may have.
Can you talk about the training the clinicians will have? Obviously, they are going to be put likely in very dangerous situations that officers are trained to handle. Are they going to be going through any sort of police academy, anything like that?
Yes, there will be a combination of, we respond to some pretty high level intensity cases currently with our community mobile crisis team. However, one of the benefits, I think, one of the several benefits of this program will be those clinicians understanding the safety from a police culture. So yeah, we will certainly we will partner with CMPD as we develop the training schedule to ensure that these clinicians are well prepared. I will also say that the responding officers will certainly be the first on scene. They will assess the situation and ensure that it's safe before providing the signal for clinicians to intervene.
I think that sequence is critically important. Make no mistake, this is not us rushing in with civilians in the car with us trying to be all things to all people. What we're really trying to do is get a situation safe and secure and then bring in experts to help us de-escalate. And that is exactly the sequence and the training that they'll go through to make sure we get that down so it's smooth whenever we respond.
When does it start? So Chief, if you, sorry.
I'm sorry. You said when does it start? Our launch date, we're looking for April. I'd be disappointed if we weren't alive by early May. Yes, ma'am.
Sorry about that. So if the subject does have a knife or a gun, will the clinician be staying in the car, or will they be, engaging in some way?
All right, so just like any other time, we got to make the scene secure. So there'll be a distance. What you're not going to see is our clinicians rushing up, trying to do the job that police do. So if they have a weapon, I've told you multiple times, read my lips, a gun is a game changer. A weapon changes the whole dynamic. So what we're going to try to do to de-escalate is keep a distance, try to engage the person to calm them down as best we can. At that point, from a distance, could a clinician try to engage? Sure, if we can make that connection. But until it's safe, as I said before, until it's safe and nobody's life is in danger, we can't de-escalate. The sequence, as I said before, is cooperate, communicate, de-escalate. Until we get cooperation and compliance, it's hard to get to that third step.
Can you give us an idea of how often the scope of these issues that CMPD officers deal with? Do you have any estimate on the number of police calls where it's a behavioral issue, or how often you're foreseeing this service, this program being used?
Sure. I think the number quoted earlier was 800 roughly, and 800 roughly. About just under 700 are people are CIT trained, and then there will be 6 experts with the clinicians in the car. We would hope to drive that 800 number down significantly, especially with our proactive work. Not only with the follow-up, with the proactive work to try to prevent some of those outcomes.
That's 800 911 calls in a year?
I'm sorry?
Just to be clear, you said 800 911?
800 responses, yes, in a year.
Okay.
Roughly. Yes, ma'am.
I'm thinking that citywide, how many teams with the clinician and the officer will be per schedule, or is it one team going to whatever division is having an issue?
Yes, it will be geographic in nature. The reason we're doing 6 is because we have response areas all over the city, and it's 24 hours. So we want at least a couple of teams available at any given time, but we also are building in the capacity to have some flexibility and some support. But again, 6 teams, 24 hours is kind of tough, but we should have at any given time a couple of teams available. We could do north and south, but right now we're still working through those details. 6 is the magic number, but because it at least gives us the capacity to respond.
What's the cost of the program, and do you think it'll pay for itself with being proactive and reducing maybe people ending up in jail or other things?
I'll answer your second question first. One life saved, you can't put a cost on that. The contract is roughly $600,000, and it's mostly for clinicians in training and the expertise that they bring to bear.
I know you get a lot of repeat calls to the same household. Will the idea be to have that same clinician respond?
Very good question. There we go. So a part of our data analysis is to see where we get those calls repeatedly so we know where an issue already exists. And then the clinician and the CIT officer go proactively to try to, sometimes it's as simple as making sure they're taking their medication. And other times it's making sure they know more services are available to them. So that's the kind of work that really matters most. Those are the kind of data points that we're really going to capture, because hopefully that will equate to reducing the 800 number that we generally respond to. Did you have more?
Yeah, I would just, to add on to that, we have found in doing this work for many years now, is that when we increase our connection to services for individuals needing assistance, that the number of calls, emergency calls to 911, even our crisis line, are reduced. And so that will be a significant portion of what these clinicians do, is working to do that linkage and connection to services.
And will you aim to have this, I know you may not be able to, but the same clinician respond to the same family so they have that rapport with them?
Ideally.
Yeah.
850,000 people. There are a lot of calls. We talked about 800 of them. We can't always get it right, but what I can tell you is that personal touch matters, and that's the whole point of community policing anyway, trying to get that personal contact so, yes, we can be proactive and have that rapport already. A couple things I got to tell you. A couple of people who've really been helping us with this, one of which is Council Member Matt Newton. He couldn't be here today. I would strongly encourage you to have a conversation with him about a personal story, because he continued to push and support this initiative because he sees the value in it. There are others on council, but him in particular. Anything else for me?
It's very linked between crisis and VA hospital as far as our heroes coming back with PTSD.
I can't really speak to that.
I mean, we certainly, with our community-based mobile crisis team, respond to a pretty high number of calls from individuals who at some point were seeking services through the VA. And again, we go and we de-escalate and provide crisis intervention. And then the follow-up portion of that would be to connect with the VA in terms of getting them reconnected or engaged with services.
Chief, is there anything you'd say to families that have been affected in the past by some unfortunate encounters where this could have made a difference?
Yes. I'd say we need to know that you're having issues with a family member that we can proactively assist in. That's the best kind of call we can get. You're reaching out to us proactively before there's a crisis. Because I can tell you many stories of our people, CIT officers in particular, going out now and just having conversations, establishing a rapport, convincing people to stay on their medication. And we don't have calls to 911 that have experienced escalation based on that relationship. So we need those calls from family members. And what I'll tell you is this, if they call us, you're basically saving a life, because that's how tragic some of these outcomes can be as they escalate and get out of control. All right?
Chief, can I switch gears? Can I ask you?
No, there will be no switching gears today. Yes, ma'am.
Can I ask you an issue some officers have expressed some concern about with the NBA All-Star Weekend coming up? The directive had been, and I'll ask you if it's still the directive,
Sure.
all hands on deck, no time off?
Yes, we've canceled days off for all of our officers, yes.
Some officers are upset that a high-ranking commander will be having a birthday party right smack in the middle of the NBA All-Star Weekend. What would you say to those officers about that?
I'll say what I say to anybody. People's time off is their time off. As long as they're not violating the law or any of our policies, I'm okay with them taking that time. What we're trying to do is allow for at least a day in the middle for everybody as best we can. But I don't see where someone's birthday party is newsworthy for me to really address. If our officers have issues with their schedule, be adults and talk to me about it. But someone's birthday is their birthday. And I can tell you, we accommodate a lot for our people. So if they have a birthday that they want to celebrate, that's a milestone, I would appreciate them talking to me directly and not through you. That's how we handle family business generally. What else newsworthy do you want to talk about?
Can
Yes.
I follow up? For some people.
You can always follow up.
The way some folks look at it is
Sure.
that there appears to be different rules for different people.
Okay.
Right? On that Saturday of the All-Star Weekend, where officers have been told that they can't get time off and that they can't
Sure.
do anything personal, but yet a high-ranking commander can
Two
use
things.
that time.
Here's what I'll tell you. They work their shift. Time other than their shift is personal time. I'm not dictating what anybody does, right? What I'll also tell you is your responsibility sometimes equates to your rank, right? I know I will not be directing traffic during the NBA All-Star. I know I'll be working long hours, though. That is my assignment. That is what I do. Sometimes your assignment allows for more flexibility. That's okay, too. But what I will tell you is I'm not going to tell people they can't celebrate birthdays if it doesn't impact the work that they should be doing. So if it were somebody who's specifically assigned to a specific critical function, it'd be a different issue. That's not the case.
Chief,
What
can
else?
I ask about the homicide yesterday involving teens? How are teens getting these guns, and how big of a problem is it?
They're getting them the same way they've been getting them, to be honest with you. Some people are stealing them. They're not being well maintained by adults who can legally have them. And unfortunately, we see the consequence. I keep saying we're putting our youth in danger when we don't secure weapons. However, whether we've gotten them legally or not, because these are the tragic consequences. Some young people make bad decisions. I just want us to be more careful in maintaining possession of our weapons so those decisions don't become tragedies.
I'm not sure if
Anything
it's the
else?
same incident she was referring to on Milton with the drug deal and team shot. What can you tell us about that situation?
You know, we update you with as much information as we can. It's an ongoing investigation. You have all I can share with you at the moment. You look like you had something, man.
Last question.
About the progress you know of and your involvement with CMS and their new security screenings, which are set to start any day now.
All right, so, oh, you did your homework. I was very vocal because I felt we could do more. Superintendent saw the need to do more. School boards supported that, put their money where their mouths were, and I'm happy because our youth are much safer. Their rollout is their rollout. I've taken a back seat because I'm trying to let the superintendent and the chief of police for CMS do their job, and they have been. I'm happy to say I think the schools are safer because of the work, and I support them in any way we can. You know, we put 50 officers as SROs, and I can tell you from their perspective, they feel better going to work because something's being done to ensure safety is enhanced at schools.
So they're the ones that are going to be in the schools. You're not sending additional officers to help with this process?
No, I'm not. That was not part of the plan. He has other resources. He has administrators and people who will be doing that work. I'm just going to support from the SRO position like we always have. Yes?
Did not do metal detectors, should they?
They're doing screenings, is my understanding. Yes, but
They're doing the wanding, but
the metal detectors were very cost prohibitive at this point. Yes, that is my preference, but wanding is effective for Panther games. I think it's effective for schools as well, so I'm happy that they were able to do that. All right?
All right, thank you all.
Appreciate it.
Thank you.
Appreciate it, Chief. Thank you, Ms. Ginn. Thank you all for coming today. Just a reminder, Ms. Ginn is available for additional interviews if you'd like, as well as Major Bowling, who's going to be overseeing the community policing crisis response team, as well as Ms. Fonda Bryant, who is a mental health community activist. So thank you very much for coming. Appreciate it.